In this study, the authors are exploring a little different perspective on assessing difficulty of surgery in obese patients who are undergoing laparoscopic procedures, here specifically procedures on the left colon. They have looked at their parameters in a fairly objective fashion. They have used something that can be quantified and made objective very easily, and that is a CT scan taken at the level of L4-5. They have measured 6 variables which are delineated in this chart and are quite explicit and easily available. They also did the study in a fashion where the observers who were making these measurements retrospectively were unaware of outcomes and were thereby blinded to the results. However, when you look at the study from terms of the principal outcome, and they were using only operating time as the marker for difficulty, and they were comparing the CT measured parameters against the standard index of obesity, which is body mass index, and they arbitrarily divided the patient group into 2 groups based on the sagittal abdominal diameter as being more than 24.8 centimeters or less than 24.8 centimeters. And when they did that, they found that between the 2 groups, the thinner people, the ones who had a lower SAD, had less operating time than those who had a higher figure. This figure was statistically significant, although just barely so. It squeaked in under the level of significance. And when they looked at the remaining 5 parameters, they were able to see a trend in terms of linear correlation, but the differences were not statistically significant, as was the SAD. There was no correlation between body mass index and operating time, and that is the major thrust of the paper. They are claiming that these CT measured parameters are far superior to body mass index in terms of determining whether a patient is going to pose a lot of difficulty during laparoscopic surgery. It's a small study, and the problem with this study is conclusions that CT scan diameters such as the sagittal abdominal diameter can predict longer operative times in laparoscopic left colonic resections. It's a retrospective study, and with a lot of holes and with the numbers reaching barely marginal significance, one has to be quite cautious about this and await more data on this subject before any sort of recommendations can be made on the value of these measures.